Hi everyone, welcome to the next presentation in the new you. Tonight we're going to be talking about one of my favorite subjects, sleep. So I think it's important to talk about the definition of sleep, and it seems that something that we spend a full third of our life should be fairly easy to define, but we're going to talk a little bit tonight about some of the mysteries of sleep. So sleep is a naturally reoccurring state that's characterized by altered consciousness, relatively inhibited sensory activity, and an inhibition of nearly all voluntary muscles. It is distinguished from wakefulness by a decreased ability to react to stimuli, and it's more easily reversible than being in hibernation or a coma. Some of this definition I really find to be kind of humorous, but I think it's an important thing to recognize that when we are sleeping, our brain has essentially disconnected itself from the rest of our body. And that's important because if we're dreaming and acting out on some of those dreams, we could potentially hurt ourselves or maybe other people who are in the room. So why do we sleep? When I was doing some research for this talk, I came across the work of William Demmett, and he's now a retired dean of sleep studies at the Stanford Sleep Medicine Center. And he was asked this question, why is it that we sleep? And he said, as far as we know, after 50 years of research, the only reason we need to sleep is that that's really solid is because we get sleepy. And really up until a year or two ago, that was true. We really did not understand why humans and most mammals require so much sleep. So here's some sleep facts. It's estimated that 70% of Americans are sleep deprived. And when you're sleep deprived, your cortisol rises. Now, cortisol is a hormone we're going to be talking about in a later lecture, but suffice to say that cortisol is a stress hormone that can actually affect our storage of fat. So when we're stressed, our body tends to take calories and put them into a fat storage system. So sleep disorders also lead to elevation in blood pressure. And so that's actually a common thing that we see in people who are hypertensive. We actually screen for sleep disorders in a lot of those patients. And infants who sleep longer at night at 12 months have much better vocabularies at 25 months. So something about sleep is really integral to brain development. So the physiology of sleep, we could probably spend an hour just talking about this one slide. I just want to kind of highlight some of the things that I find to be more important. So during sleep, we're in a heightened anabolic state. Now remember, the word anabolic means to build up, and catabolic means to tear down. So during sleep was when we're repairing our bodies, we're building up tissue, we're taking care of a lot of the maintenance type things that our bodies need to do. So we can broadly divide it into two phases, which is REM sleep and non-REM sleep. REM sleep is where dreams take place, and it's a paradoxical sleep because our minds are actually very active during this time, but our bodies can't move at all. The non-REM sleep you could divide arbitrarily probably into three phases. And so N1 of non-REM sleep is the nods. If you have sat in church or a long lecture at school, you've probably recognized this, that their eyes are starting to get a little heavy, their head begins to bob, and they're just slightly nodding, but then they kind of come back. So that's N1. N2 is the nods get deeper, and then N3, their head hits the desk and they're down for the count. So the physiology of sleep. I think here, again, we're asking the question of what's the function of sleep? And I think that's largely unanswered. We'll present some research that was done recently that I think at least gives a clue of one of the most important functions that sleep has. But largely, we don't still understand completely. So we know that we get increased waste clearance during sleep, that's a time when we restore ourselves. Wound healing actually improves when we're asleep. And also muscle repair happens better. Growth hormones actually increase during sleep. So a lot of hormones will have a diurnal pattern of secretion, meaning that they're lower in certain parts of the day and higher in other parts of the day. And certainly sleep is when we find testosterone to be higher, we find sometimes cortisol. Actually, cortisol begins going up early in the morning, begins peaking around 2 o'clock in the morning to 4 o'clock in the morning, and reaches its peak in the very, very early part right before we wake up. Energy conservation happens while we're sleeping. So our metabolic demand goes down, we start processing some of our memories. And so I think a lot of us, if we remember sleep or remember the dreams that we're having, oftentimes we'll say, yeah, my dream was about the thing that I was worried about that day. I mean, I had a patient the other day that was, she was getting ready to travel to some warm spot with a beach, and her dream was about picking out a bathing suit. It was the thing that she was really kind of fretting over, but her dream sort of released that tension, I guess. So sleep disorders. Here's 3 sleep disorders that we need to talk about. Number 1 is sleep apnea. So apnea is, the word means without breath. So if you think back to the Greek, pneia or pneumo means air, and putting an A in front of it means absence of. So really sleep apnea is just not getting enough oxygen at night or not breathing enough. And then insomnia, which is a huge problem for Americans. So many of us struggle to get to sleep. And then the one that I found to be quite fascinating is sleep state misperception. And I think this actually affects a lot more people, and it's not something that I was aware of until I'd done the research for this particular lecture. So what happens is sleep apnea. So if you experience excessive daytime sleepiness, if you find that you easily fall asleep in conversation, or if you fall asleep in theaters very easily, or say after a meal like lunch, you're always very drowsy and about to fall asleep, if you've fallen asleep at stoplights while you're in the car, these are all signs that you may have this excessive daytime sleepiness. And that's something that we really need to work with you to make sure that you don't have sleep apnea. Again, sleep apnea is going to be a stressful state for your body, and if you're trying to lose weight or you're trying to improve cognitive function, going through a time in your night where you're not getting oxygenated isn't going to help you achieve those goals. So patients that have sleep apnea are at a higher risk for blood pressure. So again, I mentioned that when we have a newly diagnosed patient who has hypertension, one of the things we think about is, could they have sleep apnea that's worsening this? Heart disease is also going to be higher risk for those that have sleep apnea. And then sudden death. For severe sleep apnea patients, they are more likely to die in their sleep. So diagnosis and treatment is imperative. And treatment for sleep apnea is a breathing machine. They can either be automated or set for continuous positive airway pressure. That's what CPAP stands for. You wear a mask, and it actually, every time you initiate a breath, the machine will force positive air in there and will actually open the airway and allow you to take a full breath. It's amazing how many people who have sleep apnea, once they start on their breathing machines, they really report a lot of things in their life improve. So it's a very important diagnosis to make. This next slide is on insomnia. So insomnia is both difficulty staying asleep or initiating sleep. So short sleep has been shown to be a risk factor for weight gain. So again, a lot of people in this program are trying to lose weight. If you're not sleeping enough, it can be a risk factor for type 2 diabetes, or what we call diabesity in our clinic. And then sleep difficulties are really closely associated with depression, with alcoholism, and also bipolar disorder. So a lot of psychological illnesses, they get worse when we don't have sleep. And in our clinic, we talk a lot about how sleep is foundational, and that if you're not getting sleep, it's very difficult for us to work on the other things that are potentially bothering you. So there's a lot of causes of insomnia, and so oftentimes we'll have to kind of work through these lists to figure out what exactly is happening. So certainly the use of certain drugs that are psychoactive, meaning they keep the brain awake. For instance, a lot of Americans are taking drugs to help with attention, and all of those can affect sleep. Withdrawal from certain anxiety drugs, especially the class of drugs called benzodiazepines, can really make it difficult for you to both stay asleep and go to sleep. Heart disease, another cause of insomnia. If you have a deviated septum or have difficulty moving air through your nose, some of us will we close our mouth at night, and if we have difficulty breathing, that can make sleep difficult. Restless leg syndrome or periodic limb movement disorders, another frequent cause of insomnia. Having pain. Americans deal with a lot of pain. In fact, in America, we consume more pain medications in the United States than the rest of the world combined. So it's a tremendous problem for Americans. And I think this is particularly one that having pain will make sleep worse, and not getting good sleep will make pain worse. So that's a snowball effect that can rapidly get out of control. Shifts in your hormones, stress, heartburn, bipolar disorder, depression and anxiety we mentioned before, disturbance of the circadian rhythm. Circadian rhythm is our natural shift between light and dark. And what's important, though, one of the signals we have for sleep is that it gets darker, it gets cooler. And with our modern lighting and being able to create artificial light at any time of the day, these circadian rhythms can be disrupted. Problems with thyroid can cause problems with sleeping. Abuses of the over-the-counter sleep aids, so taking too much Benadryl, some of these will cause rebound insomnia. And then exercising too close to bedtime, exercise can actually affect sleep. I believe exercise other times of the day actually promotes healthy sleep at night, but too close to bedtime, it can be disruptive. And then poor sleep hygiene. And by hygiene, we don't mean like brushing your teeth, but it's establishing a good habit around the sleep time. So turning off the television, winding down in the evening. In our house, we have all of our lights on dimmers, and so we lower the level of light after dinner time. We have a rule in our house that the kids don't have any media after dinner time. So we're really trying to get that brain almost like a plane. You're just bringing it in for a landing. So trying to really structure your bedtime so that you have good hygiene. I think having a TV in the room is a terrible idea. Listening to the television while you're falling asleep is trying to tell your brain to pay attention and go to sleep at the same time, and it can be a little bit of a mixed signal there. So I show this slide here. This is a beautiful slide. It's a time exposure that was taken in the middle of the desert. And I think what's remarkable about this picture is that it's truly dark in this area. To see these stars, there can be no artificial light around for miles and miles. And we live out in the country. Our family's about 15 miles from here. And even where we live, there's a large glow, sort of a dome of light over the city of Wichita. And we can just barely see the Milky Way where we are, but this obviously here is an area where there's lots of darkness. And that's something that we're losing. We're losing darkness. So here's a map that shows in 1997 what the level of light was, and then you see flash forward to 2005, very brief time going forward, and there's even less darkness. And so darkness is something that's rapidly disappearing. And a lot of these places, the lights are bright 24 hours a day, 7 days a week. So this is another example of poor sleep hygiene. I believe this picture was actually taken from an article written by the Mayo Clinic. And the iPhone used to have a bright blue light, and now most of your iPhones, if you'll go into the settings, there's a shift that you can do called night mode. And during night mode, it turns the blue light down and brings up the softer, more of a yellow light. I think that Apple didn't probably do enough to make that color shift. I think they need to make it more dramatic, but it does help reduce some of that blue light. And why is blue light important? Well, blue light is the light of the day, and that light actually disrupts melatonin secretion. It tells our body that we're going to be active, and our circadian rhythms are set on that color of light. At night, when the sun sets, it's more of an orange yellow light, a warmer light, and that actually promotes the secretion of melatonin. And then we really do need darkness to get all of the melatonin that we can. And melatonin is an incredibly important hormone for maintenance of sleep. So turn the phones off. Certainly don't have any bright lights around your face. If you're someone who has difficulty falling asleep, try to make it a discipline of moving these electronic devices away at bedtime. So what are some things that we can do to sort of hack our sleep and establish a better routine. Number one we've touched on, which is light. You can alter the light in your environment. I had a patient who was a lighting architect, and I asked her about the lights in her home, and she said that after dinner time she does everything by candlelight. And she does that so that she can really promote good deep sleep. There are some programs that you can use. One of the things that I like is a program called Flux. And Flux is a program that runs on my laptop, and as it gets later in the day, it changes the color of the light coming from my laptop, which is normally a blue light, to a more orange light, similar to the night shift mode on the iPhone. There are some glasses that can block blue light. Gunnar is a company that makes an extensive line of different types of glasses that computer users can use. They help reduce eye strain, but they're also really great for wearing in the evening when you're trying to avoid that blue light. Blackout curtains in your room can help, and then candlelight, like I mentioned, is also really helpful. Some other things that can help you are to kind of knock out the sounds that might be stimulating. So getting some white noise or a sound generator in your room can be really helpful. And then grounding, and I put a question mark on grounding because there's not a lot of research about it, but there is a school of thought that says that we spend too much of our day being insulated from the earth, and the earth is really where where we can sort of discharge these electrons that build up during the day. We all wear synthetic clothing for the most part. Synthetic clothing and insulative shoes, as you move, you're generating a lot of charge. And you've probably seen this in the wintertime when you reach out for a doorknob, you get a pretty good spark that goes across there. So some people think that spending time barefoot on the earth and just kind of allowing your body to sort of neutralize and discharge can be helpful. These are some products that I really like. This again is the control panel for Flux. This program is available on all computers, Linux, Windows, and Mac. This alarm clock here is really slick. It's called a Sunlighten alarm clock, and if you set your alarm for 6 o'clock in the morning, the light begins to slowly turn on about 30 minutes before it's time to wake up. This particular alarm clock's pretty expensive. I think it's around $200. You can achieve the same thing by buying a module on Facebook or on Amazon, and we'll put this on the Facebook group. This module can plug into any lamp and make it into one of these sunlight simulators. And then these sleep masks will be helpful if you're in an area where you can't control the light. So if you're on an airplane or you're in a public space or maybe a hotel where there's light coming in through the window, these masks are form-fitting, and so they're very comfortable to wear, and of course some earplugs to help block out the noise. There's a picture of the Gunnar blue light blocking glasses. Here's an example of a UV light, and so this is another way of sort of stimulating your circadian system. You know, right now, this time of year, we wake up and it's very dark outside, and so sitting in front of some blue light can really stimulate your body to enter into that good pattern of daylight, you know, and get you awake and moving during the day. This device at the bottom is a cranial electrical stimulator. This is something that is available, which kind of taps in to help people sort of establish healthy rhythms. So here's some sleep tips that I'm going to read through. It's important to go to bed and to wake up at the same time each day. And even if you have a different routine on a Saturday and Sunday, try to go to bed at the same time and to wake up at the same time. It's going to establish a good rhythm for your body, and really, especially for those of you who are having difficulty sleeping, this is a good discipline to have. Make sure you're just using your bed for sleep and romance only. No reading in bed, don't watch TV. It's going to send a mixed signal to your brain. And then create a nice aesthetic environment that encourages sleep. Use restful colors, eliminate the clutter and distraction. Create total darkness. Those blackout curtains can help. I mean, putting tape over smoke detectors that are blinking or things like that. I mean, the smallest little light can really interrupt your sleep. So make sure that you're keeping your room as dark as possible. Avoiding caffeine late in the day can help. I mean, I use caffeine in the morning, but if I drink it too late at night, it will keep me awake. And then alcohol, even though it helps you go to sleep more quickly for some people, it can actually disrupt your REM sleep and make it so that really restorative deep sleep isn't happening. Get regular exposure to daylight. So again, that 20 minutes a day, that light from the sun, it goes into your eyes and actually can help establish that good circadian rhythm. Lots of different chemical signals are reliant on the light and dark cycle. So try not to eat 3 hours before bed. Eating a heavy meal will actually lead to a bad night's sleep. And then try not to exercise vigorously after dinner. Some gentle stretching or something like that might be fine, but you don't want to do any heavy exercise. Some more sleep tips that you can read. Writing your worries down. One of the things we hear a lot of people say is they have difficulty shutting their mind off. And so writing things down, making lists can be very helpful. Taking a hot like salt bath, like using Epsom salts and things like that, raising your body temperature can help you establish a good sleep. Getting a massage or stretching right before bed can also help you relax. Warming up your midsection brings your core body temperature up, establishes some proper chemistry that's needed for sleep. Even going with a hot water bottle and curling up with that can be really helpful. Avoid medications that are going to interfere with sleep. Obviously, talk to your physician first before you stop anything. And then some herbal therapies like passion flower or valerian can help with sleep. So there's some dosages there that you can read. And then one of our favorite is taking magnesium. Magnesium has a really calming effect, can help relax smooth muscle. So taking anywhere from 200 to 400 milligrams, and some people need even more than that. So kind of the tip with magnesium is keep going until your stools get kind of loose, and then maybe back off a little bit. All right, so to wrap up, if you have questions, please ask them here. If there are things that you're concerned about, problems that you're having, post it in the Facebook group because other people are probably suffering from the same things and they're going to want to hear the answer as well. Call our office if you need anything additional, and then be sure to keep engaging others as we go through this program together. We'll see you guys next week.